Like, share, and subscribe.
Hello. So today I'm going for the next video. I'm going to speak about a very important topic, basically about the newer treatment algorithms or newer treatment modalities that are available for managing diabetes. Now you may be thinking why this is important for you. So basically, one thing we should understand is diabetes is not being managed or treated the same way as how it was treated probably 10 or 20 years ago. Now, towards the treatment plans or treatment or management techniques or management modes as such, now we have various newer drugs added to the diabetes treatment armamentarium. For instance, I would like to focus on two particular classes of drugs. One is the GLP-1 analogs and one is the SGLT2 inhibitors. So I'll just give a little background about these two classes of drugs. So first, about the GLP-1 analogs. So GLP-1 is basically a hormone that is produced in our gut from the intestines. So what they have found is that this hormone, if it is extracted and given to subjects with diabetes, especially those who are obese, it has a wonderful result in terms of getting the blood sugars under control and also in reducing the weight and thereby reducing the risk for heart attacks and associated complications. And the other group of drugs, what we typically call the SGLT2 inhibitors, these are another novel class of drugs where the high blood sugars is actually brought down by excessively disposing of the blood sugars through the urine. So the reason why I'm focusing on these two particular classes of drugs is that through various clinical data or through clinical trials, it was found that these two classes of drugs, they actually reduce the risk of heart attacks or reduce the risk of heart failure, if I have to be specific, in subjects who have diabetes. So because of this data that is available, in 2018, a major clinical body that actually comes up with new consensus guidelines based on the data that's available, the body known as ACE, American Association of Clinical Endocrinology, and the American College of Endocrinology. So these two bodies, they come up with consensus guidelines every year. So recently, 2 years ago, they've actually come up with the consensus guidelines where they have promoted the use of these two category of drugs as a second line in therapy for managing diabetes. So the first line again remains metformin, which we commonly prescribe. So these two category of drugs could be used as an add-on therapy to metformin, especially for those subjects who are at high risk for heart attacks and other cardiovascular complications. So this is very important because when these drugs are used along with the present metformin or current treatment for diabetes, it significantly reduces the risk of heart attacks. And because of this is a big advantage because, as all of us know, heart attacks and such cardiovascular complications are the number one risk factor for early deaths in these people who have diabetes. So when the physicians use these drugs judiciously in these category of patients, we can actually improve the quality of life of these patients and also prevent early deaths because of these complications. So please speak with your doctor and discuss what might be the best therapy for you based on your risk factor. The doctor should be able to decide what is the best treatment for you. So hope this video was useful. Until next video, it is bye from Dr. Rohit.